Hi, how does midline interruption end up throwing in complications or possibly creating or causing ADD, ADHD? And you'll see this in other diagnoses like autism. One of the things that's really a big issue with ADD, ADHD is the midline. So in other words, I'm sitting here and I'm like, what, mom? And I can just look over. So there's a visual midline from every eye, more through the nose, chest, sternum. But you have midlines all over, depending on how you look at the body. If you're playing sports and so forth, you need midline, right? Midline is just not cut, it's not like I took a saw down my body. And so when there's all these kind of milestones going into play, but especially you didn't grab your feet correctly, you didn't come to sitting, right? You're starting to have that midline to crossing midline interruptions. So things come in. So your convergence starts creating an issue. So you have a visual convergence, you have a fine motor convergence, right? I catch a ball or throw a ball, right? And then I have it gross motor convergence, right? And so its convergence is not just a visual thing, it's part of your midline. But then you have to go where you're crossing midline, or you have a visual convergence, which is much more sophisticated, or gross motor skills, where I can start standing up. And not only where I'm kicking the ball this way, again, where I have a midline convergence, where I can start kicking the ball out or doing other things to create that. One of the things that you'll really see with ADD kids is they sort of see through their chest. So you and I, if I said, hey, Michelle, can you get me that skull, right? I can even see it on the video, and I'm like, is this what you want, kind of thing? No, it's the other ones that are sitting there. Okay, fine. I don't necessarily have to look at it. With a child that has ADD, ADHD, one of the things you'll see really early on is they look with their chest. So instead of where they have, again, where they are in space, they go, I'll get it. And so they jump up, so now the chest can see it. Now you're gone. And now it's like, and you're like, get the skull, get the ball, whatever you're saying, but they're gone because now they're on to something else. And that's where you're seeing the attention deficit disorder come into play. So again, where you see a kid doing this, I said, I always can tell if a child's special needs or not by the age of 2. Because the age of 2, they can start with the head tilt. And it's like, my mommy bounced a check today and she had a fight with my dad. They're just telling these stories and they have these sway. You're just not going to see that with special needs. With special needs kids, they have a very horizontal and a very vertical movement in the head faces. They don't have that cutesy kind of, that kind of thing. And, the peekaboo and all of that. Because they're just, again, they're seeing with their chest. So you'll see coming to sitting, if they're sitting up and so forth, they should be able to, again, do that kind of scoot. But again, where they can come over and do all that instead of, they just look like a bull in a china shop is another sign. These are all midline interruptions. So I just posted a video and where I said that the child has very little peripheral field and very little midline. And they're like, well, he's concentrating on the tape. Exactly. He's a kid, right? He should not be sitting there like this. He's got tunnel vision, right? Running around doing all of this. And I'll post this video with that so you can see in the feed. But one of the things that you should be able to do is, again, I'm gonna use this skull as a demo in a second, but when you have something, a child, they still work the room, right? So what visual convergence is, a lot of people think this is a midline crossing. Well, it might be for the nasal septum. This is the only straight line in the human body, right? But I'm not crossing a visual midline. I go to look up and I fall over. Right? And this is where I have those issues. What your eyes should be doing, and this is for peripheral, is your eyes need to cross a midline, right? And that's what you're seeing. And then again, look at my whole torso, everything starts crossing midline. So when a child, and this is what you see with autism, they have a very weak peripheral midline crossing. So one of your first milestones is tummy time. I get it that this is an adult skull, but you can see the nasal septum really easy here. When this line here in tummy time, and I just covered this, right? Tummy time should look like this. I lay down, I come up, and I come over. What this does is it opens up all your facial bones, right? And they're moving it, all of that. And that's what starts, this is why your eyes aren't meant to work purposely when you're a baby, your first weeks of life. right? They're kind of like this, and they just look like drowsy because the focus isn't there. You don't want those muscle complications creating complications within this. And this is where you have the biggest problems with kiddos in the NICU. They have intubation, Taggart tape like this, and you get this kind of facial expressions because, again, you have midline interruptions, and that was done medically to your child. We had to keep your child alive, but these are where these issues come into play, and you'll see children like that. Again, very poor visual midlines, where they're like, and they can move, they kind of have a right eye and then the left eye, but they don't have that crossing of midline through the nasal septum, and they certainly don't have it visually. So these are the things that I look for. I didn't say that there's issues with the eyes, and astigmatism and so forth can cause also visual midline, but I look for visual functions to happen. And so when the comment is, this is what you do for a child that has developmental issues, no, you're causing more developmental issues. They need to work the room. I would have had a ball toss in there, or maybe some kind of upper obstacle course where they have to pick up a ball and drop it in the basket, and you'll see it. Can they do it this way, or do they have to stop and do it? Now they're forgetting the tape. Things like that you work on. Obviously, you want to make sure that they can initiate a midline or crossing, and that's the newborn movement assessment. It goes back to when we're babies. I'm looking for this stuff from the day that they're born, not when you've got already developmental problems. I know, unfortunately, most parents have the developmental problems, and then they're coming here to learn from me. One day this will be just common knowledge from the day these munchkins are born, and you won't even know who I am. But I have a feeling I have a little bit of work to get there. That's what you're looking for. So again, I see movement, I teach movement, I am movement, and it's just easy for me because I've just been doing it for so long. Honestly, this is just a personal story. I had a very violent father. Trust me, you learn to see someone starting to grit the back of their teeth, or when those pinkies start to curl, because you can get hurt, right? And so I just got it was self-protective. You can see this, I'm not the only one out there. The horse whisperer actually has this background, which I thought was really interesting, that we're both about touch. I'd love to meet him. But anyway, you'll see this, that again, it's just, I learned to see movement as a protective. And thank goodness I'm not at that stage anymore, but still, we all came here for a reason. We're here to learn about development, but I learned development or see development through movement. Most people see development through the brain, right? But I can tell you right now, ADD and ADHD, everybody's going after the brain. And hopefully I just showed you the big component is really movement. And if you don't change the movement, you're not going to change the brain. We can't change the brain and expect movement to just show up. You know what I mean? We have to make sure that they can initiate it and go into it. And that's what you're looking for in your child for optimal development, right? And that's what we're not looking for, bypass. They've already bypassed. That's why they're in the diagnosis stage, let's say, or developmental delayed, or even globally delayed stage. We're looking for optimal development at any stage in our life, from our optimal development to yours and to your children. Thanks. Hi, Christina.